This next panel is, it's really fun, collaborative labor of love. I have known Nancy Judy, I don't know for how long, Nancy, 12 years I have known Nancy. Yes, in between each of these, this is the very healthy part of this. Up and down, up and down. Nancy, as far as I'm concerned, was one of the people literally making sure that Sodexo for many years had the voice, had the impact, and also brought brain health to the forefront. They have been a big supporter of social impact partners, and last year we put out the neuroprotective diet with the Vibrant Minds. And this year we have collaborated. We are so excited. There's so many Nancys, and Nancy, I'm going to call you out. Nancy Cullen, who is here from the Alzheimer's Association and has partnered with us. Everyone believes that workforce and brain health is critical. Dr. Richardson, also from Texas, all good things come from Texas, who has worked with us from a scientific standpoint. And Mindi, who many of you may know, was one of the co-authors of the Neuroprotective Diet and has been a real partner in all of this work. I think I'm supposed to be on this panel, so I'm sitting down. I'm going to encourage the panel to do something. If you can't see people because of the podium from over here, if you guys don't mind, why don't we just stand and talk so that when you're talking, people can see you. Thank you. And hi, it's so nice to see all of you. I've met so many of you and know your names, and I'm glad to know you. I need to make an assignment. If you can't hear the speaker, somebody talk, speak up, tell us, okay? Because I was really having a hard time hearing George. We were leaning in George, but I didn't want to interrupt you, so finally I interrupted Hannah. Okay, so I'm Nancy. I worked at Sodexo for 17 years. It was a very proud partner to Sarah and to Connected Living and to Social Impact Partners. And I retired a year ago, and now I am all in as a volunteer for Sarah. We made a new title as a Chief Advocacy Officer. What do you think? So I did moderate this panel, and a year ago we were standing here in front of you talking about Vibrant Minds. So a new piece of research talking about nutrition and the connection to brain health. This year we're going to bring you something new. And I invite all of you to invite someone from this panel to speak at your events about these papers, because they've been really, really important and really changing the way people talk about nutrition, and now we're going to talk about lifestyle. So, first of all, Sarah, first question. We all love you, and thank you for your passion and your leadership and for bringing us all together. It just makes us all smile, so thank you for that. But we want you to talk about the opportunity, right? So, lifestyle is a huge thing. We all spend a lot of time at work. What is the opportunity that we have right now from brain health at work and in terms of lifestyle? Thank you, Nancy. And I actually encourage you guys to stand the whole time so we're not hidden behind that. They can just all see you guys. I literally, if I, as a CEO, and for any CEO out there, I can't imagine not having this as a central strategy. We all just heard George and Kana and Dr. Reiser. We know we spend, over a lifetime, I think the report said 90,000 hours in the workplace. It's where we spend our days. And for any CEO or organization out there who does not think this is their most important initiative in terms of time and attention, attracting new talent, retention of existing talent, or the talent that's sitting there not paying any attention because they can't. So the ability for us to create spaces where we can honor family, we can encourage people to maybe have a walking meeting versus sitting all day long. My partner Michael and I do that. When I call him, he gets up and starts walking, and guess what? He gets lots of steps a day. But it really is a new day. It is a new day, and for any CEO who thinks it's the old day, they're not going to have employees, they're not going to have productivity, and the numbers show us that companies who do embrace this have a 4x in ROI. So, to me, it's obvious.
Okay, Dr. Richardson, you're next. First of all, thank you very much for your contributions to the white paper. You really gave us the grounding in science, which is so important to all the work that we do. So can you talk a little bit about that? Give us the basics.
Thank you so much. Brain health really refers to how well the brain functions. On a cognitive level, how do you pay attention? Do you concentrate? Do you remember? On an emotional level, do you manage your emotions? Or do they manage you? Do you ride that emotional roller coaster, fight, flight, freeze? Socially, do you stay connected to your colleagues? Do you stay connected to who's important to you in your life and your values? Neuroscience shows how the brain performs is shaped by how the brain responds to the cues you get in your daily life. The physical environment you live and you work in, the air that you breathe, the natural exposure to light, all of this impacts your brain. Our foundations, our food and nutrition, our sleep, our physical movement, how we respond to stress, impacts our physical and our mental health. In the past, mental health has been associated with mental illness. Today, brain health is associated with longevity and brain wellness. Everything you do, whether it's at school or your work, your brain operates as your primary performance engine. Whatever task solving you're doing, creating, collaborating, decision making, depends on how those neurons and dendrites are wired and firing. And brain waves that wire and fire efficiently manage our energy. They manage our thoughts, our feelings. When a brain is supported, then the brain optimizes at a higher performance level and builds long-term resilience. Resilience is not about bouncing back from a low point in your life. Resilience is continually moving forward, learning, and adapting. And as you're learning new things, thinking about things differently, reading more, you're creating neuroplasticity in your brain. That is the brain's superpower. That is what gives the brain the ability to wire and fire differently and to change. When the brain is threatened with cognitive overload or lack of psychological safety, the brain gets stuck. It does not have the plasticity it needs to move it forward. So when we talk to people about stress, 30 to 50% of people say that most of their day-to-day stress comes from the workplace. Stress is one of the biggest threats to the workplace brain health. And when you prolong activation of your prefrontal cortex in response to stress, that executive center loses focus. Maybe it loses impulse control, strategic thinking. When the brain detects a threat, the amygdala activates more quickly than the prefrontal cortex can respond, resulting in survival behavior, not rational thinking.
That's never happened to me.
From a long-term perspective, brain health is cumulative. Repeated patterns of overload without recovery increases our risk of anxiety, depression, dementia, and Alzheimer's, all of which isolate us from our daily life. Workplaces that support regulation through food and nutrition, through social connection and purpose, build brain health. Each of you stop and think about one aspect of your brain health. For 30 days, invest in it. Build your brain capital.
Thank you, Dr. Richardson. I can listen to you talk all day. Next, we're going to hear from Mindi, though, and I think most of you know her because she's been on the speaking circuit for the last year, talking about the vibrant mind and the connection of nutrition. She is the National Director of Nutrition for Sodexo Seniors. So, Mindi, can you reconnect us to the nutrition aspects of brain health?
Yes, I will. Thank you, Nancy. So I'm going to rewind here a year. A year ago, plus maybe a week or two, we were here launching our first white paper, Vibrant Mind, and that was all about nutrition and brain health, right? We looked at all the research, all the different diets, all the different nutrients, and we ultimately came up with our own new neuroprotective diet that incorporated all of this research into this diet. And at Sodexo, we really took this into our senior living communities where we could see how to implement that because we found through market research that the current seniors have a very interest in brain health. Like that's one of their top 2 health concerns is brain health, right? So we looked there, but then we looked holistically. Sodexo serves people from birth to death, right? So we provide food and nutrition for babies born in our hospitals, children in K through 12, young adults in our universities and colleges, corporate settings, all the way to seniors. It's a lot of people. But then, taking it one step further from there, which kind of ties into our new white paper with the workplace, are all the employees that we serve. So think about your hospital cafeteria where we're serving all of the staff, and then especially our corporate services segment where our number one consumer is the employees, right? And we know from research that the earlier you adopt nutritional strategies for brain health, the more impact you're going to have later in life. So that means your workplace, because as others have said, it's a place that we spend a majority of our lifetime is in the workplace. It's one of the most powerful environments we have to impact brain health. But what does that look like in a practical setting? So in these environments, in your employee cafeterias and places that you serve your employees, you're going to look to introduce more brain healthy recipes and options on your menu. And you're going to emphasize those through signage and labeling. And also, you're going to have it at multiple or all price points. So it doesn't exclude anyone from choosing those healthy options. In addition to that, you're going to de-emphasize all of those processed and ultra-processed foods. So think about you're checking out at a cafeteria in a line and you see all those chips and the candy bars all there looking at you at checkout, right? You're going to want to de-emphasize those and really emphasize choosing those brain healthy options. But the bottom line really is this: we don't make one healthy choice to impact our lives, right? What's really going to make that impact is making those daily choices at your meals where you live, where you work, where you learn, to really make the impact on brain health.
Nancy Cullen, we're so lucky to have you with us. Thank you for contributing to the paper and for being here today. She's from the Alzheimer's Association, very well known around the country and the world for the work that you do. Can you tell us a little bit about the training that you're doing in workplaces and your new task force?
Absolutely. So thank you, everybody. You know, when George asked, or somebody had asked everybody to raise their hand, we know for the past couple of decades, many of us in this room have been in the fight against Alzheimer's and dementia. And we're not stopping, but the science has really helped us tell a bigger story with brain health. And the front door to the long continuum of Alzheimer's is a new dialogue that we need to change that mindset and extend that dialogue in everything that we're doing. So that's the reason why we're joining with many of you here today to have that urgent call in every sector, whether it's in public health, in policy, in schools, and in the workplace, and in the health systems, to say, do your part. And so we know that in the workplace, where everybody has said, and when necessary, we gotta take action. What do we do today? So one thing that the Alzheimer's Association is doing is we know that with US adults, 2/3 of the individuals have at least one risk factor for cognitive assessment. And then two, we know that 86% of them are motivated and want to do something about it. So they are fine and waiting to try to take control of their brain health. But then we also know that there's people already on the journey, working caregivers who are trying to reduce their stress, be more productive at work, while at the same time, what can they do to help their brain health so that they don't get it and their children get it and so forth. So that's why the Alzheimer's Association is looking at the workplace to say, because we know that there's so many good examples of practical solutions being able to discuss about risk reduction strategies, let's arm the workplace with some tools and resources that they can easily embrace and celebrate and recognize those that are leading the way. So at the end of February, we are previewing a new program called Brain Health at Work. And it gives an opportunity for any organization, big, small, you name it, to be able to assess what are we doing to educate our employees and offer resources in our human resources practices. So the way the program works is you take a simple assessment, it takes about 15 minutes, but what's nice about it, as soon as you're done with that simple assessment, you get your own private organization portal of resources, not only for your human resources team, but then also resources for you to be able to give to your employees so that they too can be empowered to take on their own risk reduction strategies. And then lastly, they'll be recognized with the Alzheimer's Association, because we want to join with you and stand up with pride to say that you have a brain healthy workplace, that you are committed not only to the health of the individual, but the cognitive health of your biggest asset, which is your people. So we look forward to rolling that out, and with the help of a workplace advisory council that we're joining with SHRM and also the U.S. Chamber of Commerce, and then naturally Sarah is joining us as well to ensure that we stay relevant, that we stay with the trends, because we know the science is evolving, and that we continue to add new resources for the workplace so that you can use as you see fit to hopefully help change that dialogue with changing it from don't worry about Alzheimer's and dementia, but don't worry about brain health, because there is things that you can do today to impact your cognitive risk decline.
Well, thank you, Manuel. We have 3 minutes left, so each of you get a very quick question. And I'd like you to keep it to 5 words, 10 words, something like that. There's a lot of CEOs and a lot of decision makers in the audience today, so what's your advice, things they should do following this panel? Sarah, you're first.
Collaborate with someone else in this room and bring brain health into the workplace. It's obvious.
Good one.
Leigh.
Well, workplace is not a wellness perk. It's a performance strategy. And if you invest in it, you can see a large return on investment.
So from my perspective, it's start with food. Start with the food, add those brain healthy options for your employees, and de-emphasize that processed food.
And I would say your biggest asset is your brain power of your employees. Visit alz.org, Brain Health at Work, and sign up. And as soon as that program is launched, do that assessment and get access to some resources that you can magnify within your workplace.
Thank you.